In recent years, there has been an increase in severe intestine disorders, particularly inflammatory bowel disease and diverticular disease. And bowel cancer itself is very common, particularly in Western countries. Within the bowel, there are billions of bacteria called the microbiome, and these are essential for our immune system, our physical and mental health, and our quality of life.
The Insights Company is a developer and manufacturer of therapeutic medical devices that are prescribed by colorectal surgeons and stomal therapists for use with patients with intestinal diseases, including intestinal failure. The company is enabling a new standard of care based on the clinical work Professors Ian Bissett and Greg O'Grady have been progressing over the last 30 years.
In cases of bowel cancer and inflammatory bowel disease, often the affected portion of bowel needs to be removed. This is followed by the formation of a stoma, where the intestine is joined onto the skin so that the intestinal contents, known as chyme, can be drained into a stoma bag. This allows the bowel downstream to heal without the contents of the bowel affecting it. In the traditional care pathway, the chyme within the stoma bag is discarded. However, the large intestine and the microbiome within rely on the chyme for its nutrition, and the blood supply to the bowel alone is not enough for its sustenance.
So this means that under a traditional care pathway, patients recovering from these conditions are at risk of dehydration and kidney problems arising from their fluid losses, as well as issues from gut atrophy and loss of the microbiome. So in patients who have stomas created higher up in their small intestine or their proximal small bowel, or have fistulas, they're at risk of very high output fluid losses, and that can mean malnutrition. For those patients, we treat them with intravenous nutritional support, which has serious risks such as sepsis and liver injury. All of these issues add up to more cost, more time in hospital, and a reduced quality of life for our patients. So the inside system reinfuses the lost chyme back into the body where it belongs, together with its fluid and nutrients. And that's safe to do once any downstream surgical joints have healed. So patients can have a complex fistula or stoma for 6 to 12 months or more. And using the inside system means that during this period, they receive far more nutrients and absorption through their gut than would otherwise have occurred. And this means that patients experience fewer complications and a better quality of life through this part of their journey. The inside system has been shown to reduce or remove the need for higher cost invasive therapies such as parenteral nutrition in many of these patients. So patients can easily and quickly reinfuse the chyme at their own convenience, whether at home or at work, meaning much greater freedom. And taken together, these improvements are of major benefit to our patients.
The Inside System is the first of a portfolio of innovations that dramatically improve the clinical and economic outcomes of patients with intestinal diseases.
Our innovative solution cuts down the length of time in hospital and reduces nurse visits, meaning that patients can recover safely in their own homes. We believe the Inside System can become a new standard of care, particularly in complex patients with high output gut losses. And for this reason, it has been awarded Breakthrough Device Designation by the US FDA.
The Insights Company is really proud to be leading the treatment of colorectal disease and gut health at a global level.